What if I told you that not all sweet fruits are off-limits for diabetics? In fact, some of them might just be the health allies you've been missing. Imagine eating delicious, juicy fruits that don't just satisfy cravings but actually help lower blood sugar, reduce nerve pain, protect your kidneys, and even support heart health. Sound too good to be true? Well, it isn't. In today's deep dive, backed by science and decades of clinical insights, we'll uncover the top 3 underrated fruits that every diabetic should incorporate into their diet. These aren't your usual apples and berries, these are fruits often overlooked, yet packed with medicinal properties tailored to combat diabetic complications. Plus, I'll share practical tips, ideal portion sizes, and real-life examples of how these fruits have transformed lives. And don't miss the bonus strategies at the end that will ensure you're maximizing these benefits daily. 1. Cantaloupe, the hydrating healer. Cantaloupe might surprise you as the first on this list. Often dismissed for its sweetness, cantaloupe is actually a diabetic-friendly fruit when consumed correctly. With a glycemic index of about 65, many assume it spikes blood sugar. But the real measure for diabetics is glycemic load, and cantaloupe's is a modest 4 per half cup. This means its actual blood sugar impact is minimal when eaten in moderation. Beyond its low glycemic load, cantaloupe is a hydration powerhouse, composed of over 90% water. Hydration is crucial for diabetics, especially because elevated blood sugar can dehydrate cells and strain the kidneys. By keeping the body hydrated, cantaloupe aids in reducing glucose concentration in the bloodstream, promoting smoother kidney filtration. Additionally, cantaloupe is rich in beta-carotene, over 100% of your daily vitamin A needs in 1 cup, which protects retinal health, vital for diabetics prone to retinopathy. It also offers 95% of the daily value of vitamin C, boosting the immune system, collagen production, and even helping reduce HbA1c levels. From a mineral perspective, it provides potassium and magnesium, key for maintaining blood pressure and supporting insulin sensitivity. Regularly incorporating cantaloupe could even reduce inflammation, support joint health, and bolster the gut microbiome, critical in improving insulin response. Take the case of Susan, a 62-year-old with type 2 diabetes who struggled with dehydration and joint stiffness. After integrating cantaloupe thrice weekly, alongside her regular diabetic-friendly meals, she reported fewer dizzy spells and less joint pain within a month, all corroborated by a visible drop in her HbA1c. 2. Apricots, the eye and nerve protector. These small, tender fruits are nutritional powerhouses. With a glycemic index of 34 and glycemic load of just 3 per fruit, apricots release glucose slowly, avoiding sugar spikes. Packed with beta-carotene, apricots offer up to 60% of daily vitamin A needs, protecting vision and reducing retinal inflammation. Vitamin C, potassium, magnesium, and iron round out its benefits, protecting nerves, boosting circulation, and shielding against diabetic nephropathy. But here's a fascinating point: apricots are rich in chlorogenic acid, which protects the liver and helps combat non-alcoholic fatty liver disease, NAFLD, common in diabetics. Studies, like those published in the Journal of Functional Foods, confirm apricot polyphenol role in reducing oxidative stress and supporting liver health. Apricots also contain compounds like quercetin and beta-cryptoxanthin, known for anti-inflammatory and anti-cancer properties. For diabetic patients, who are more prone to certain cancers due to chronic inflammation, this makes apricots a vital addition. Meet Robert, a 58-year-old diabetic with early signs of retinopathy and fatty liver. By including fresh apricots in his diet thrice weekly, alongside medical guidance, Robert experienced improved liver enzyme markers and a slowdown in retinopathy progression over 6 months. 3. Plums, the nerve soother and heart protector. This fruit is often overshadowed but is a goldmine for diabetics. A medium plum has a glycemic index of 35 and glycemic load of 4, making it safe for blood sugar levels. Plums are rich in anthocyanins, giving them their deep red-purple hue, and these compounds directly protect the pancreas and nerves from oxidative stress. The chlorogenic and caffeic acids in plums help reduce neuroinflammation, enhancing nerve health and reducing diabetic neuropathy symptoms like numbness and tingling. Potassium in plums aids in blood pressure control, while soluble fiber helps regulate cholesterol and gut health, crucial for diabetics aiming to maintain cardiovascular integrity. A study in the British Journal of Nutrition noted that regular consumption of plums can improve bone density and reduce joint inflammation, a double win for diabetic seniors. Lisa, a 64-year-old with type 2 diabetes and neuropathy, began eating one fresh plum daily paired with nuts. Within 3 months, she reported less foot tingling and better sleep quality, a result of improved nerve function and stabilized nocturnal blood sugar. Here are some bonus strategies to maximize these fruits. Pair with protein or fat. This slows sugar absorption. Portion control. Stick to 1/2 to 1 serving per fruit type per meal. Rotate fruits. Prevents nutrient imbalances and keeps the gut microbiome diverse. Prebiotic combinations. Pair with chia seeds, flax seeds, or yogurt to enhance gut health. Avoid syrupy or canned versions. These often contain added sugars detrimental to blood glucose control. To wrap up, cantaloupe hydrates and heals, apricots protect the eyes and liver, and plums soothe nerves and shield the heart. These fruits, when consumed wisely, are more than just snacks, they're functional medicine hidden in nature. If you're diabetic, integrating these into your weekly meals can profoundly impact your health, from blood sugar control to preventing long-term complications. But always consult with a healthcare provider for personalized advice, especially if you have advanced kidney disease. So, which of these fruits will you try first? Comment below with your choice and any personal experiences. And if you found this guide valuable, don't forget to like, subscribe, and hit the bell for more expert health insights tailored for diabetics.